for joining us today. My name is Dr. Robyn Wolintz, and I am a multiple sclerosis specialist and neuro-ophthalmologist. I will speak to you today about MS and vision changes. I often get calls from patients concerned that they have awakened with blurred vision. They're very worried that they may have an MS exacerbation. The good news is that blurred vision does not always mean a multiple sclerosis exacerbation. It may actually mean that you just need a new pair of glasses. The first thing you should do is contact your eye care specialist and your multiple sclerosis specialist. You will be asked whether or not the blurred vision started suddenly, whether you have noticed if it's one eye or both, whether your eyes are red, whether there is any pain with eye movements, whether you've noticed any color changes. You will also be asked whether you have any other symptoms, such as poor coordination, changes in your bladder habits. If the blurred vision involves both eyes in an adult, it is unlikely to be optic neuritis. If it is one eye and associated with pain in eye movements and reduction in color vision, you may in fact be experiencing optic neuritis. You will be asked to come in for an examination. You will be asked to read the eye chart, usually using each eye separately. You may also be shown a red target to tell whether or not there is a difference in the intensity of the redness with each eye separately. Finally, your eye care specialist or your neurologist will use an instrument called an ophthalmoscope to look in the back of your eye. Sometimes they can see swelling of the optic nerve. At other times, they may tell you that your optic nerve in fact looks normal. This could imply that the swelling is behind the segment of the optic nerve that is visualized, called retrobulbar optic neuritis. The good news is that most cases of optic neuritis improve without any treatment. There was a study performed to determine if treatment is actually necessary in the situation of reduced visual acuity. One group of patients received intravenous steroids, followed by oral steroids. Another group received just oral steroids, and finally, one group was observed without any medication. Over 80% of patients in each study group had improvement in their visual acuity to at least 20/30 or better. That is 2 lines away from what we consider perfect. This occurred even in the group which did not receive steroids. The group that received the intravenous steroids saw improvement in their vision approximately 2 weeks sooner than the patients who did not receive any treatment. On average, it takes approximately 8 weeks to notice improvement in vision. Therefore, those who received treatment saw improvement within about 6 weeks. However, ultimately, everybody or most patients had improvement in their vision whether or not they were treated with medication. This does not mean that you should not inform your physician that you have noticed changes in your vision, because you need to be evaluated to make sure that something else hasn't occurred. It is important to keep your eye care specialist and your neurologist abreast of any changes in your health.